and get started. Welcome everybody to today's webinar. My name is Brooke Yamakoshi, and I'm a water, sanitation, and hygiene specialist with UNICEF's East Asia and Pacific Regional Office based in Bangkok. So that's who I am. As we get started, please introduce yourself in the chat box and let us know where you're signing in from. As a courtesy, I'd also like to let you know that this webinar is being recorded. So today, we're really excited. We will be reviewing the findings of a regional review of menstrual health and hygiene in East Asia and the Pacific, which was carried out through partnership between the Burnet Institute, WaterAid, and UNICEF, and covers the period of 2016 to 2022. So you can see our agenda here on the screen. We will have a 20-minute presentation of the key findings of the report, followed by comments and reflections from 3 distinguished government representatives. And after that, we will hear reflections from colleagues at UNFPA and the Pacific Menstrual Health Network Secretariat. Throughout the presentation, please put your comments and questions in the chat box or the Q&A box. So you may see we have a very fancy Zoom webinar feature of a Q&A box where if we don't have time to take your questions live, we will be able to answer them in a very easy way so that you can keep track of what the question was and what the answer is in the Q&A box. So we encourage you to use that. So now let me turn it over to my colleague, Dr. Julie Hennigan from the Burnet Institute to begin the presentation of the regional review. Julie, over to you, and please just let me know when you need the next slide.
Sure thing. Thanks, Brooke. So pleased to be sharing with all of you the findings from our regional review. There's a huge amount to be that's covered in the review, so our goal with the presentation today is really to give you an orientation to the report and to highlight some of the key findings. Our review used there was a 2016 regional review and synthesis for menstrual hygiene management. We used that as a starting point, and as Brooke mentioned, this means that our progress that we were documenting was from the period of 2016 to 2022. Our review had 2 objectives. The first was to document the current state of policy and programming to support menstrual health across 19 countries, and to bring together informants' perspectives and insights on barriers and enablers to effective action. The second objective was to synthesize the evidence of the effectiveness of policies and programs in the region, and we also aimed to document the lessons learned as well as barriers to high quality monitoring and evaluation. Next slide, please, Brooke. To accomplish objective 1 of assessing policy and programming, we used a desk review of policy in 19 countries across East Asia and the Pacific. We also had a survey with over 50 key stakeholders, as well as more than 50 key informant interviews that we used to identify current policy and programming efforts. To accomplish objective 2 of assessing progress in evidence, we used a formal systematic review, including systematic database searching and screening and quality appraisal of identified studies that tested the effectiveness of menstrual health interventions. We also used our key informant interviews and survey to collect information about monitoring and unpublished evaluation efforts. Surveys and interviews with stakeholders also served to identify recommendations and barriers and enablers to both policy and programming and to achieving effective M&E. A technical advisory group, to whom we're very grateful, provided feedback and guidance throughout the process. Next slide, please, Brooke. There were 2 guiding frameworks for the review. The first was really to help us understand what is being addressed. And the second was to understand how. The what being menstrual health. So we use the definition of menstrual health as a framework for documenting progress. The definition, which was published in 2021, highlighted that across contexts, there are consistent requirements for women, girls, and all people who experience a menstrual cycle to achieve menstrual health. So these are having access to information and education, having access to materials, facilities, and services to care for the body during menstruation, access to timely diagnosis, treatment, and care for discomforts and disorders, access to a supportive social environment that's free from psychological distress, as well as freedom from discrimination and exclusion related to menstruation. And so we assessed policy and progress across each of these requirements, acknowledging that they are interrelated and that policy and service delivery efforts might address multiple requirements in their work. You'll see these icons throughout the regional and country reports, and they help to orientate us across the review and map out what is being addressed and where there are gaps. Next slide. Our second framework was to understand the how being the enabling environment. And for this, we used 5 building blocks used by the Sanitation and Water for All partnership. So these were policy and strategies, institutional arrangements, including coordination, funding and financing, capacity, and monitoring, evaluation, and review. And you can see on the right of the screen here in our report table of contents that we've used this framework to structure our summaries of progress. For the first 4 building blocks, along with a summary of service delivery, we present progress in separate chapters for East Asia and for the Pacific. And then we present findings related to monitoring and evaluation combined across both regions in chapter 4. You'll also see this how framework in tables presenting a bottleneck analysis, looking at the policies and plans that do exist and tracing them through aspects of the enabling environment to understand what is getting through to beneficiaries. I'll now hand over to Chelsea Huggett, the technical lead for equality and inclusion at WaterAid Australia, to provide some highlights from the review of policy and practice.
Thanks, Julie. Hi, everybody. Happy Menstrual Health Day month, we could say, in the lead up to Menstrual Hygiene Day. I'll share with you an overview of the findings from Objective 1 from the study, which looked at progress on policy and programming. So in the report, which I've just put a link in the chat box too, so you can see it there, the first step we took in applying the menstrual health framework was to look right across policies, plans, and strategies of government at the national level and assess the menstrual health framework against those policies. So on the next slide, you'll see a table there, which outlines table 5 and table 10, which present a snapshot of how menstrual health fits across key policies. So the sectors we looked at were health, in particular sexual reproductive health and adolescent health. We looked at water, sanitation, hygiene, gender equality, humanitarian response, education, and disability. And we assessed each policy using the definition of menstrual health in the framework. What we found when we mapped this out across the 5 domains was that there was only one country, Indonesia, that had policies which addressed every component of menstrual health. What the review found on the next slide is that the strongest policy commitments were addressing the first 2 menstrual health requirements. So when it came to access to education and information, this was mostly addressed through National Comprehensive Sexuality Education Curriculum in schools. So in East Asia, for example, 6 countries had incorporated menstrual health into education in schools, and 5 Pacific Island countries had policies which in some way addressed menstrual health education in schools. Every single country across the whole review had addressed menstrual health through the second requirement of access to services and facilities. And this was mostly found through national WASH policies or guidelines or targets, and particularly was prevalent in school-based policies, although there were examples of WASH in healthcare facilities. There was really limited policy commitments across the remaining 3 requirements of menstrual health. Fiji, Indonesia, and Vietnam were 3 countries where we found that there were menstrual health non-discrimination and participation policy provisions. And Vanuatu was the only country where we found there was a national disability policy which also talked about menstrual health. So when we talked to stakeholders about what their perspectives were around barriers and enablers to policy progress on menstrual health, on the next slide, you'll see some quotes there of what we heard from informants. So most informants agreed that incorporating menstrual health into existing policies was a really strategic first step to advance menstrual health outcomes. So as the quote from Mongolia shows there, putting menstrual health into guidelines was really a stepping stone or a way to open up awareness. Review informants from countries where there had been limited policy progress expressed a need for further awareness raising, and a lot of informants shared anecdotal evidence about conversations that were happening within government departments, which showed a growing interest in this area. So looking at the second building block of institutional arrangements, what the review found on this slide was that menstrual health was really slipping through the gaps in terms of government responsibilities, department roles, and coordination mechanisms. So where the greatest momentum was happening on menstrual health, or the greatest progress, there was really clear ministerial leadership. There was well-assigned responsibilities and coordination mechanisms were in place. The review found that in East Asia, leadership was most often happening or being led by the education and health ministries, whereas in the Pacific, responsibility for menstrual health was usually being implemented by departments responsible for WASH in schools. However, the review also found that it was not always clear which ministries were leading menstrual health, and this led to coordination being somewhat lacking and intergovernmental coordination being a real gap that was identified. A positive finding was that there were existing forums to leverage. And so, for example, WASH in school working groups had been a really great place to drive institutional coordination for menstrual health. So when we talk to stakeholders about the barriers and enablers around making institutional arrangements stronger, we really heard a lot of feedback around there being, where there was siloing happening, this had resulted in a fragmented approach to menstrual health. So for example, one domain like essential services like WASH being delivered without having the corresponding education or information, and this was undermining progress. Review informants also highlighted that coordination worked best when governments had good systems, leadership, and clear accountabilities in place, and that meant there was a broader range of menstrual health issues being addressed. So moving on to the next pillar of the building blocks, this one is around funding and financing of menstrual health. Across the review, this was there was really limited evidence that was found in this area. There were examples where menstrual health had been costed within school WASH infrastructure, for example, in the Solomon Islands, Indonesia, and Timor-Leste. And from the government of Fiji, we've got a really great example that we'll learn more about shortly, where the Fijian government had invested an allocated amount of funding for the last 2 years into a national voucher scheme for girls in schools to access sanitary pads. So despite these positive examples, we really struggled to find any evidence of menstrual health costings across education or health sectors, and very few countries had set really clear, explicit milestones that could be costed against for menstrual health. When we talk to stakeholders about financing and funding for menstrual health, the quote on the screen there from the Ministry of Education in Timor-Leste is a good one, where stakeholders often talked about having some funding or allocation for menstrual health activities within their broader budgets, but that it wasn't enough. And for example, the activity is not covering all schools. So this is a really key finding from the review and highlights the critical need to improve national funding systems. So moving on to the third building block, this one is around capacity. So we looked for things like whether there were comprehensive capacity building plans on menstrual health. And again, we found really little evidence of this existing. So even where there had been quite a high level of attention to menstrual health in a certain country, we didn't find capacity plans alongside that growth. So both regions was seen as a real barrier for enacting strong support for women, girls, and people who menstruate. The review found evidence of support from international donors, global bodies, and NGOs, so helping to deliver financing, technical support, and training. There were a lot of examples of that. But Review informants also talked about some of the challenges in delivering that work. So in particular, staff turnover, budget constraints, meaning that that wasn't a sustainable outcome. So on the next slide, we've just highlighted a few key tables in the report, which really draw together the building blocks and what we learned across those 4 pillars. So we've tracked the policies and plans that we identified in each country, what the implementation arrangements and coordination looked like, how that was being implemented and delivered, and what monitoring was happening alongside it. So it really starts to build a picture of the extent of service delivery and how policies or plans are progressing. So the final aspect of the findings that I'll share with you today is that we looked at what progress is happening in programming, what actually is being delivered on menstrual health. And there's some really great tables in the report. Again, table 7 and table 12, which document each sub-region and paint a picture of what's being delivered. The review found that delivery was quite small scale, which meant it was really difficult for us to assess whether there was national coverage of menstrual health services that were meeting the needs of a whole population group. Most services were being delivered as part of bigger WASH, health, or SRHR services. And again, we see that those first 2 requirements of menstrual health are mostly what's being delivered. Most services were being delivered in school settings, so reaching adolescents. And so we see that there's huge gaps in the adult population being reached, children with disabilities or children not going to school. Around that second requirement of access to services and facilities, most of those services were being delivered in schools again, but there was WASH in communities and healthcare facilities that were addressing menstrual health. And we also saw a real increase or focus on access to menstrual products as well. And so when we talk to stakeholders about what did they see as some of the barriers and enablers to programming or service delivery, you'll see here that informants highlighted stigma and taboos as one of the most frequently cited things that we heard throughout the review, and that existed right across government decision makers, right through to participants who were participating in programs. Just to pull out one enabler that we heard that stakeholders felt that this could be a really critical way to improve programming on menstrual health was all of the work that's been done around curriculum development, and that could be an opportunity to really standardize and drive quality menstrual health education across schools. So that gives you a flavour of the findings, a bit of a rapid overview. I'll hand back to Julie to talk us through the monitoring, evaluation and learning findings.
Thanks, Chelsea. I'll keep moving quickly and I'll finish off our presentation by sharing just a few key highlights from our work around Objective 2, understanding progress in monitoring, evaluation and evidence. Overall, we found that this was a really significant gap across East Asia and the Pacific. We outline in the report that by monitoring, what we mean is continuous, sort of ongoing, continuous or repeated data collections, which track delivery and progress in a population. And by evaluation, we mean time-bound objective assessments, such as to test the effectiveness or compare implementation strategies for a specific intervention on defined outcomes. Looking first at the national level, we found that the majority of policies and plans do not have aligned monitoring. There has been certainly progress since 2016, especially in the WASH space, where the 3-star approach to WASH in schools has helped support monitoring across a few dimensions, including sex-segregated sanitation, menstrual health education provision, and product supply as part of that approach. Most of the progress that we have seen in national monitoring has really been focused on assessing outputs. So things like in the WASH in Schools program, what is being delivered, such as WASH infrastructure. Across the region, we didn't find any monitoring of outcomes, so measuring women's and girls' unmet needs or menstrual health. Looking forward, stakeholders highlighted the continued need to prioritize national monitoring and clearly assign monitoring responsibilities. They also highlighted that frameworks and clear indicators for monitoring are needed, which could be facilitated by recent advancements at the global level, such as the shortlist of recommended indicators for monitoring menstrual health. Finally, budget allocation and strengthened capacity is needed to ensure high quality data collection, analysis, and use of monitoring data. We also found slow progress in monitoring at the program level. On the next slide. Stakeholders highlighted barriers for monitoring menstrual health in the planning phase of work. Firstly, they noted that menstrual health was often one component of a broader SRHR or WASH program. And this meant that menstrual health often fell through the cracks and wasn't specifically included in the program theory of change or monitoring indicators. In the data collection phase, a lack of straightforward tools for monitoring menstrual health, particularly quantitative tools like survey measures, was a barrier. And this was paired with staff who were overstretched and the realities and difficulties of field data collection. Finally, in analysing and using data, restricted timelines for analysis and a lack of funds to actually apply lessons that would be learned from analyses and monitoring activities were really frustrating for practitioners. As enablers, stakeholders highlighted the value of collaboration with research institutions, simple tools for measurement where they existed, and the positive effects where they did have funding and donor support for monitoring. Looking very quickly at our systematic review, which found that evaluations have increased since 2016. However, we still found that there is insufficient evidence for the effectiveness of any menstrual health interventions in the region. The studies we identified typically found that education sessions increased menstrual knowledge and that menstrual health products, including reusable products that were provided through programs to different populations, were seen as acceptable. But neither of these sort of groups of studies tested the effects of this education or material provision on broader outcomes, such as health or education. We also aim to evaluate interventions or look at studies of interventions that improved access to care for menstrual pain. Studies that we found that were eligible did this through self-care strategies or education. They reported that stretching and breathing exercises reduced self-reported pain, but there was methodological issues and none of these studies included a placebo control. We only found one study that included an intervention with some attention to the supportive environment for menstrual health. And what I think is also a really important finding from the systematic review was that none of the evaluations that we identified were testing interventions that really reflected current policy and programming in the region. And that at the same time, current policy and programming were not being evaluated. So lastly, to bring this rapid presentation together, a few key overarching findings. We found absolutely that attention to menstrual health has increased during the period covered by our review, 2016 to 2022. In understanding what has been addressed, we found that most attention has been given to information and education and materials, facilities, and services for menstrual health. And this was true in policies and service delivery. In looking at how we are making progress and identifying bottlenecks, we found that there has been progress in policy, but that the responsibilities of different ministries or subnational departments for implementation is often unclear. The lack of clear responsibilities was one of the biggest bottlenecks that we found to progress, because then it wasn't clear who should be allocating funding or monitoring. Lastly, we found that monitoring and evaluation was weak throughout the region, and therefore it wasn't possible to assess the effectiveness of these policies and programs, and it also meant we had a weak evidence base for decision making. So very quickly looking forward, our review highlights the need for continued advocacy. We want to see the SRH and WASH policies and programs that have been initiated to be effective and far-reaching, and to see new attention to requirements for menstrual health that have been neglected, including pain and discomforts and the supportive social environment. We need to build the evidence, including evaluations, to inform policy and program approaches and to monitor menstrual health at program and national levels, which can be facilitated by partnerships, standardized, straightforward tools, and clear responsibilities. We're suggesting the need for more clearly outlining roles and responsibilities, prioritizing costing and funding, and enhancing collaboration and coordination to avoid duplicating efforts and maximizing our collective work. And finally, we want to leave no one behind. I think as Chelsea highlighted, a lot of the work that has been identified has focused on girls in schools, and we need to look beyond just this group to meet everybody's needs. Thanks. Back to you, Brooke.
Fantastic. Thank you so much, Julie and Chelsea, for the great overview of the report. It's a lot of information to pack into this short presentation. So I definitely encourage everyone to download the report and read more. And you can find the link that Julie put in the chat box. Julie mentioned in the methods that we had an online workshop a couple of weeks ago with the review informants. And first of all, thank you to all of the review informants who have joined this webinar today. The review informants voted for the priority actions and findings that they thought would help accelerate progress in their countries. And I wanted to share that the top voted findings from the group of informants from East Asia were number 1, better roles and responsibilities, and 2, capacity building. While in the Pacific, it was also clearer roles and responsibilities, and then number 2, reaching populations outside of schools. So we're very pleased today to hear from 3 different governments in the region about how their countries, their national governments that they represent, are planning to accelerate progress on menstrual health. And those 3 countries are Cambodia, Fiji, and Papua New Guinea. So first, we will hear how the government of Cambodia, which has been a true leader in the region on menstrual health, envisions accelerating progress with remarks from His Excellency, Dr. Chea Somnang. Dr. Somnang is a medical doctor and currently holds the position as the permanent vice chairman of the Council of Agricultural and Rural Development in Cambodia. He's also chief of staff for His Excellency, the Deputy Prime Minister, and also co-chair of the WASH and Nutrition Sub-Working Group. Excellency has been well known as a WASH champion in Cambodia and an activist for many years. He was previously the country coordinator for the Water Supply and Sanitation Collaborative Council, and also the director of the Department of Rural Healthcare in the Ministry of Rural Development from 1994 to 2013. Excellency, we're so excited to have you with us. Thank you very much for joining us, and over to you.
Thank you, Bruce. Thank you for introducing me to the panelists, and very well of the introduction to my background. Thank you very much, Bruce. Okay, let us start the inform first. In Cambodia, we're supporting from development partner and international NGO. Also, we have a various ministry to involve in the MHA in Cambodia. We have 4 ministries that play a very important role for the MHA in Cambodia. The Ministry of Rural Development, they are focusing on the National Action Plan on Rural Water Supply and Sanitation and Hygiene. Ministry of Women Affairs, they focus on the capacity building to the Commune Council for Women and Children as the focal point. In Cambodia, the CCWC, Women and Children, is very important structure at the grassroots level. From Ministry of Health perspective, they promote the MHA in the health facility and including the national guideline for WASH in health and healthcare facility. The last ministry that play very important role, that is Ministry of Education, Youth and Sport, is promoting and implementing MHA in school, including the National School Health Policy. So this is the 4 key ministries that play very important role in MHA in Cambodia right now. Even though although the ministry, they fulfill its duty as mentioned to support MHA agenda, but Cambodia needs strengthening ministerial coordination and intra-governmental coordination for better communication, implementation, sharing experience, and M&A. As we look at an SDG target, the global principle of leaving no one behind, very critical that MHA agenda is better integrated into the existing relevant national policy and the commitment of those policy to MHA at national and subnational level. I think that is the first step of strategy for improving MHH outcome. Also, it must be holistic implementation in institutional and community setting up with the particular attention to the most marginalized and minority population in Cambodia. In order to fill the gap of the national budget for MHH implementation by concerned ministry, Cambodians should focus for appropriate strategy to mobilize commune investment plan fund that is the funded to the commune council, the lowest administration of Cambodia. And also we need to have the properly strategy to involve private sector participation in MHH agenda, including the access to information, material facility, and social environment. Also, Cambodia needs a comprehensive capacity building plan for MHH at all levels, including national and subnational, talking like financial and technical support. Although there are some M&E systems exist to track the progress of MHH project implementation, such as we image from Ministry of Education, Youth and Sport, Management Information System from Ministry of Rural Development, but the tool to drive investment need to be strengthening at national and subnational level. So that one including promoting inclusion and participation of all key stakeholders to share experiences and best practices in order to establish truly government-led and effective coordination mechanism. So based on that, my presentation on that one, I would like to talk about some key actions should be considered and developed in Cambodia. The first one, we need to have clearly revised and defined the role and responsibility of various ministry agency involved to establish inter-agency committee for international and national cooperation and development for MHH program. The subnational coordination structure must be clearly revised and define the role and responsibility of the various provincial departments involved. Number two, develop a joint action plan for MHH in Cambodia. Three, develop effective M&E tool to track the progress of MHH implementation by various ministry and agency involved. Fourth, develop MHM implementation case study and advocate for national policy commitment. Another one is develop comprehensive capacity development plan for MHH at all levels. And finally, my proposed action, that is to develop proper strategy for financial and technical support from development partner to the ministry involved. That's all from Cambodian side. Thank you, Brooke, and thank you for your attention.
Thank you so much, Excellency. Really fantastic to hear these very detailed reflections. I noted that you talked a lot about these interagency roles and responsibilities, also the need to leave no one behind and the need for true inclusion, which I think is so important, such an important finding from this review also, and an action plan that includes the financial aspects as well as the capacity building aspects also at subnational level. And finally, M&E. So thank you very much. I think these are very relevant, probably not only for the context that you have developed them and been leading them in Cambodia, but probably many other countries here today also.
Thank you, bro. Thank you.
Thank you. So I'll move on now to our next speaker. Our next speaker today is Ms. Aftara Khanum, who is a Senior Finance Officer for Grants in the Grants Unit of the Government of Fiji's Ministry of Education, Heritage and Arts. So Ms. Aftara and her team support Fiji's National Sanitary Product Voucher Scheme. The scheme is now in its second year of delivery. And I think many of you have heard about this scheme and maybe have questions for Aftara and are very curious to hear more about how it's working. So we're so thrilled to have you here today. And over to you, Aftara.
Hello, everyone. Thank you so much for having us. I'll start by giving you a brief overview of how this initiative has come to be and how it is progressing right now. This initiative was brought in our national budget for year 2022. It provides female students in years 7 to 13 with sanitary pad vouchers, and it has been in force for the last 2 financial years. The implementation of this initiative included two components. Firstly, it is sanitary pad vouchers to all girls in year 7 to 13, and also providing education and awareness on menstrual health. The sanitary pad vouchers that are distributed to all the eligible girls, it includes 6 vouchers in a booklet, which each cost, which is have a value of $4, and these are valid for one school in one academic year. These can only be redeemed by the students as long as it is stamped by the school. The financial and budgeting aspect of this initiative includes that it has been budgeted at $1.5 million for the last financial year, and it has provided assistance to around 65,690 students in last financial year. In the progress we're making for this assistance program is that it has been budgeted for again in this year with approximately $1.4 million of budget, and the conditions still remain the same. And upon rollout, we have discovered that we have assisted 57,600 students so far, and we have projected an increase of $250,000 for next financial year, as we are looking forward to assist female students in year 6. However, this is subject to approval. As far as moving forward for this initiative in our country, is that we aim to create awareness for this subject matter for all boys and girls in this regard, and we aim to create leadership working groups of adolescents that will advocate menstrual hygiene. Thank you so much. If you have any questions, please feel free to raise it.
Great, thank you so much, Aftara. It's so interesting to hear more about this voucher scheme, and great to know that you're able to monitor so precisely the number of students that have been benefiting from year 7. It's really exciting to hear that you're thinking about expanding this to year 6, and maybe looking at other subject matter that you could integrate into your program. Thank you very much for joining and sharing with us today. I see that we have already had 2 questions in the question and answer box. If anybody else joining today has a question for any of our speakers, please put it into that question and answer box, and we will do our best to be able to answer all of those. I also see that we have colleagues on from at least 11 countries today. So those include Cambodia, Laos, Indonesia, Fiji, Vanuatu, Papua New Guinea, the Philippines, as well as countries from outside of the region of the review, India and Nepal, the US and Australia. So thank you all very much for joining. Our next speaker is Ms. Estella Bonbon, who is a rural wash planner within Papua New Guinea's National Wash Program Management Unit, and that's under the Department of National Planning and Monitoring. Unfortunately, I believe that Estella is on a field monitoring trip right now and is not going to be able to join us live. She's having trouble with her connection. But if she's able to sign back on later in the webinar, we will come back to her for her remarks. She would like to speak about inclusion of women and girls, people living with disabilities, and marginalized people, making sure that they're given equal priority and participation in WASH program implementation. That's a key part of her role. So now we'd like to move on to our set of discussants. We're really thrilled to be able to hear from some other types of stakeholders on what this regional review and priority actions could mean for practice in the region. So we have 2 speakers today. The first is Sylvia Wong. She is the Regional Adolescent and Youth Advisor with UNFPA Asia and Pacific. And the second is Hannah Tamata, who is the Pacific Menstrual Health Network Secretariat. So we're really thrilled to have them both joining us. As I mentioned, first, I will turn it over to Sylvia. Sylvia, in her current role as Adolescent and Youth Technical Advisor, she provides thematic leadership and technical guidance for policy and strategy development, evidence-based programming, and advocacy for and with adolescents and youth. And prior to joining UNFPA in this role, she was UNFPA's innovation lead and managed the UNFPA Innovation Fund. So we're really thrilled to have her here. And Sylvia, over to you.
Great. Thank you so much, Brooke and colleagues, for the opportunity to join this important webinar on menstrual health in the Asian Pacific region, and to be invited to provide some reflections on the findings from a sexual and reproductive health and rights perspective. At UNFPA, we firmly believe that menstrual health is part and parcel of women and girls' sexual and reproductive health and rights, because it forms a starting point of one's reproductive health journey. And it also, we know that when girls and women better understand how their bodies work, they can make informed decisions about their health and their well-being. But we also know that menstrual health is a rights issue. And because poor menstrual health undercuts fundamental rights, including the right to human dignity, the right to health, and the right to education. And so for these different reasons, we are stepping up our menstrual health work in sexual and reproductive health and rights, and also in comprehensive sexuality education programs with our partners. And this is why I think the report findings are very important, as it articulates ways that decision makers, institutions, and partners all have a role to play in policies and programs that support girls and women to better manage their menstrual health safely and with dignity, and to build community support toward that end. On where there appears to be some progress among the 5 domains that our colleagues from the Burnet Institute and WaterAid had shared, I was pleased to see overall that there's progress for ensuring information and education about menstrual health, such as through the school system, and whether that be through WASH programs or sexuality education. However, we also know that the quality and delivery of puberty education that includes menstrual health through sexuality education can be quite uneven. So we do have quite a lot of work to do to improve in that area. For example, a recent regional review of comprehensive sexuality education found that nearly half of the girls, through an online survey, reported that they did not receive enough information about puberty and menstruation before they experienced it for the first time. And so I could only imagine the confusion, the possible shame and stigma they may have felt, because they simply didn't know what was going on and what to do, because they learned about it too late through the program. So this is why I really like the finding that we need standardized curriculum-based education, such as through comprehensive sexuality education. So regardless whether the girls and young people are in the school or out of the school, they can access scientifically accurate, fact-based, and non-judgmental information before puberty occurs and about menstrual health. And also when taught in an interactive and fact-based way, comprehensive sexuality education can provide that safe space to debunk myths about menstrual health, to reduce stigma, and to show how menstrual health is a normal part of life. And also when we think about what we can do better for programming, I'd like to hit on 2 main points. One is on the access to care to manage discomfort, and also on fostering a supportive environment. For the first part on managing discomfort, here I believe we can do more programming on integrating menstrual health within health systems for reach and scale. And so this would include promoting menstrual health within health services for women and girls, and to prioritize treatment to those suffering from menstrual disorders. So we can do more on training healthcare workers as community partners to provide the essential counseling and care regarding menstrual health complaints, and to help women and girls with self-care practices at any point whenever they show up for services, so that these healthcare workers can just ask how they're doing. And likewise, we can do better on capturing data for when women and girls show up at the health services when they're experiencing menstrual health discomfort, and to better understand their needs. For fostering a supportive and non-discriminatory environment, UNFPA has done work to change community level norms on menstrual health and to challenge myths, but certainly more can be done in this area as well. So this can include sharing information on promising practices through various platforms. I had mentioned comprehensive sexuality education as one platform where we're reaching younger people at earlier ages to change norms and attitudes, wherever women and girls can gather as well. And importantly, we need to do more with boys to show that it is healthy, it is natural, families to reinforce these messages for both boys and girls. Likewise, I want to hit on the point that menstruation is not cause for women and girls to be restricted to stay at home and not participate in community life. So we need to work and understand what are the interventions with communities, families, and leaders to combat misperceptions. Let me conclude that this report is timely and so needed. It is a call to action and a call for collaboration to support the government coordination we heard about earlier from the government of Cambodia to improve monitoring and evaluation on what works, stronger capacities, and more strategic linkages with the health sector, especially sexual and reproductive health. And I look forward to seeing how these important findings can go forward to be executed, to be implemented so that every girl and every woman, wherever she is in the Asia and Pacific region, can better manage their menstrual health and live lives with improved health, more productive lives, and fulfilling and lives with dignity. So thank you very much, Brooke, and I appreciate and look forward to what all the other colleagues would have to say as well.
Great, thank you so much, Sylvia. It's so valuable to have this perspective from the sexual and reproductive health and rights sector. I think that, you know, myself and colleagues at WaterAid obviously have a big focus on the water, sanitation, and hygiene side of things. And it's so important that we continue to collaborate with agencies like UNFPA and others working in the SRHR space. So thank you very much for these comprehensive reflections. I particularly am so happy that you talked about expanding access to care for discomfort and disorder, and also a supportive social environment, because those emerged along with non-discrimination and participation as the biggest areas of weakness or the biggest gaps in current service delivery and in what program policies are currently addressing. So thank you very much, Sylvia. Now I'm going to turn to our next speaker, our final speaker for today, who is Hannah Tamata, and she is currently the Secretariat of the Pacific Menstrual Health Network, and she's based in Vanuatu. Hannah leads coordination across the network members and the rollout of learning and advocacy on menstrual health efforts in the Pacific. So Hannah, we're really excited to hear from you and more about the work going on in the Pacific. We haven't been able to test, I don't think, your mic or video yet. So can you let us know if you are able to unmute and speak? I know you were having some trouble with the connection earlier. Hi, Hannah. Hi, Hannah.
Hi, Brooke. Can you hear me all right?
Perfectly.
All right.
Perfectly.
Thank you, Brooke, for allowing the space for the Pacific Menstrual Network to have a voice in this platform. We've been working, we are a network of Pacific women actors, and including one male advocate in the network, that we advocate for menstrual health rights of women and girls around the Pacific. So in relations to the findings of this review, the Menstrual Health Network conducted a research on opportunities and barriers to progress menstrual health in 2019, and the findings were similar to those of the regional review, which for us confirms the needs. There's more need for work to be done in the menstrual health space in the Pacific and the Asia Pacific region. And it was good to see the alignment of these findings, and it has served the network as a confirmation on what our findings were during that time we did our research. Therefore, as a network, we would like to see more action, especially along the lines of action priority number 3, for more attention to populations outside of schools, especially for those in the communities where they are more less fortunate. Would like to see a lot of work done in that area. And there were a few more action points that we took into interest, which was action point number 8, attention to neglect requirements of menstrual health, and also action number 5, which was the government standards to ensure quality requirements. This is a very big need in the Pacific that our governments need to really recognize and have quality requirements for menstrual health needs as well. And lastly, we also had action number 6, which was specific costing and budgeting for menstrual health needs. So most oftentimes it's in the Pacific, this menstrual health is a topic that nobody wants to talk about. So we would like to see more allocations towards this topic so that the women and girls in the Pacific can benefit in learning how to take care of themselves during menstruation, and making sure that the equipment or infrastructures they need within the community or within the schools also of good standard and hygiene. Yes, Brooke, I think those were the points that we had picked up from the findings of the review. Thank you very much.
Great. Thank you so much, Hannah. Thank you so much. It's really great to hear about the reflections from the Pacific and the findings in particular that resonated with your own review from 2019 and what you think needs to be done next. I really note the focus on marginalized communities, but also that this is a marginalized topic itself, right? So I think some really excellent points about leaving no one behind on a topic that is already often left behind itself, as well as the attention to the neglected requirements. I think that echoes some of what Sylvia was also talking about on care for discomforts, supportive social environments, and non-discrimination and participation. So thank you, Hannah. I think it's also noteworthy for everybody joining today that the Pacific is the only sub-region, I think, in East Asia and Pacific that has any coordination mechanism for menstrual health. And Hannah, again, is leading that coordination. Great. So now I'm going to ask, we had a question come in the chat from one of our participants, Angelique, who was asking Excellency Chea how private organizations could play a role in the menstrual health plan that he mentioned for Cambodia. So I will turn it over to you, Excellency, to answer that one live.
Okay, thank you, Brooke. Thank you, Brooke, and also thank you, Angelique, that asked question to me about how the private sector play a role in HA plan in Cambodia. I think in here we have some of our Cambodian colleagues from UNICEF, from WaterAid, and other ministry as well, mostly from Ministry of Education, what they can respond to do. But I can share my practical experience to you, Angelique. What is the private sector role to support the HA plan? I think water sector is very important. In Cambodia, water sector is not done only by government side. It means private sector had to participate in the water sector, providing clean water supply, sanitation, and hygiene to school and also to community. So in the MHA in school or community, I think Cambodian we use private sector as part of improving water sector, and also concerning to MHA in community and in school. Besides of providing services of hardware both to community and to school, I think education is also part of the private sector, can be participate in our plan as well. So this is my quick response to you. That share mostly experience on WASH that can be more effective to MIA plan in Cambodia. Yeah, thank you, bro.
Great, thanks, Excellency. Great, so several opportunities, I think, for the private sector to play a role. Great, so I think we're coming up now on the end of today's webinar. We're really happy for everybody's active engagement, and I see there's a lot of questions still coming in the Q&A box. So while our team continues to take a look at and answer those, I wanted to just give a few final remarks about the way forward with this regional report. So as Julie and Chelsea both said, we had key findings from this report, not firm recommendations for any one country or any one actor. I think we are really encouraged by the discussion today, as well as with all of the review informants about how you think these findings could translate into action in your own countries or your own organizations. So we have done this launch, you'll notice, a couple of weeks before Menstrual Hygiene Day. The theme of Menstrual Hygiene Day, which is the 28th of May, is commitment. And we're sure that many of you are going to be considering commitments for your organizations or supporting other actors in your country, collaborating with them to make joint commitments. So one of the reasons that we were happy to have this webinar before Menstrual Hygiene Day is that we're hoping to give you some ideas for new commitments that you could make and commitments on the type of action that could unlock progress on menstrual health, that maybe as you're reading the report, you think, wow, that finding is really true in my context, in my organization, or in the areas where I work. That would be a great commitment. So what we've done is we've actually put together some examples using the materials here. You can see on the screen. Sorry, let me put it on the screen. You can see here that the campaign materials are available from the NHJ website. And then we would really encourage you to link your commitments to some of the key areas where progress has been lacking in the region or maybe in your country. So for example, if you see that there has been good policy attention to menstrual health in your country, but maybe less attention to costing and to budget allocation, maybe you want to make a commitment around that. And we put together some example tweets here also and social media posts that could help you. You can tell I'm not a big social media user, struggling here with my terminology. But I think it's really important to be able to amplify these commitments across a variety of different platforms and in your national celebrations. So here are some examples. We will share them out with all of you after this webinar today. And we encourage you to visit the website and download the regional report. We will also have country reports for 14 different countries that were included in the review. And what we will do is probably follow up with all of the key informants from those countries to let them know once these reports are final and posted on the website, which we hope will be before Menstrual Hygiene Day. And I may ask if one of my colleagues could just post the link again to the regional report in the chat box, maybe for people who got kicked out of the meeting or joined late. Okay, I think that's everything from me. So my final point is sincere appreciation for all of our speakers. Excellency Chea Samnang from the government of Cambodia, Ms. Aftara Khanum from the government of Fiji, Sylvia Wong from UNFPA, and Hannah Tamata from the Pacific Menstrual Health Network. I'd also like to really thank our collaborators in this report, Julie, Ali, and Heather from the Burnet Institute, and Chelsea and Pisai from WaterAid, as well as my colleague Arturo, who is helping us to manage this webinar and disseminate this information far and wide. So thank you very much, everyone, for joining, and we hope that you will download and share the report with others that you work with in your organization and your country. Thank you for joining.
Thank you, bro. Nice to meet you.
Thank you, Excellency. Very nice to meet you.
Good to meet you.
Thank you, Brooke. Congrats.
Thanks so much, Sylvia.
Take care.